Hey guys, Dr. Anthony Davis at the Davis Medical Group in East Texas. First, thank you for supporting this YouTube channel. I appreciate it more than you know. Growing fast, help me grow, like my videos, share my videos, and even more importantly, subscribe and get your whole family to subscribe. We're shooting for 1,000. Let's get there as quick as we can. It won't be long. Today's video is about something that a majority of people know all about and feel and worry about. Today we're going to be talking about fatigue. We see it every day. I'm tired, I'm always tired. How come I'm tired? So this video is about how to solve that problem, or at least look at it in a way maybe where we can figure it out. So pay attention. Here we go. So how would a doctor define fatigue? I think a doctor would define fatigue as, I just don't feel good. I'm tired. I wake up tired. I go to bed tired. Every day I'm tired. The irony is, the very interesting thing is that 80% of the time, there's nothing wrong with you. Nothing wrong with you. I can do every test that I've got, and I might find something, but it was on accident. That was not the cause of your fatigue. 80% of the time, your fatigue is caused by your lifestyle. Only 20% of the time can we find something. And those things can be important. I mean, goodness, the list of things that can make you tired, and I'll give you that list in a minute, is a mile long. But it's pretty rare to actually find a reason. And a lot of people already know that. They come in and they're like, I'm tired, I don't feel good. I just want to make sure there's nothing wrong with me. I want to make sure I'm just not getting older and lazy and tired and, I'm not taking care of myself. I'm okay with that if that's all it is. So what does it feel like? Well, a lot of people walk in and they say, I'm just tired. I can't get out of bed. I don't want to get up in the morning. I went to bed and I was tired, and I woke up and I was tired. I hear that. I hear that all the time. And so what we want to do, you also notice that there's a lot of associated symptoms with even that psychogenic exhaustion. Exhaustion not caused by something. Headache, achy all over, just pain, weakness. But it's a subjective weakness because they can actually squeeze a Coke can and crush it. It just don't feel as strong as I want to feel. So that's how fatigue shows up in the clinic. How do we work it up? So how do we work it up? Well, obviously we're going to take a history and we're going to find out what it sounds like and really document that. But if we're going to look at specific diseases, we're going to look at autoimmune diseases like do an arthritis panel, check a SED rate, a CRP, basic inflammatory markers, maybe a rheumatologic test like rheumatoid arthritis, or even a lupus test to rule out those things. We're going to check your blood count to make sure you're not anemic, make sure there's no sign of cancer like lymphoma or leukemia. We're going to do basic blood work. We're going to check the liver, the kidney, the blood sugar. All those things are going to come on the basic labs. We're also going to include thyroid and vitamin levels. If you haven't watched my thyroid and vitamin B12 and vitamin D videos, you need to, because they can certainly cause fatigue. That can be one of the most common symptoms of those problems. We're also going to potentially do serial temperatures where you go home and check your temperature for a couple weeks and let's see what it's running. If it's consistently low, that could be a sign of a thyroid issue as well, or even a progesterone deficiency. But all that's pretty technical, and I don't want to get too lost on the technical. And ladies, I was taught when I was doing emergency room medicine, I was taught if there is a man in the county and a woman menstruates, one of the most important tests is always going to be a pregnancy test. If you've ever been pregnant, makes you tired, and we don't want to miss that. It's very, very important. We're also going to check your stored iron, your iron level, your ferritin level to make sure you're not running low on iron. All that kind of goes hand in hand. There can be a few little oddballs, and so we're going to check maybe potentially if you've had exposure Lyme disease titers, if you've had tick bites or been exposed to areas where Lyme might be an issue. Even heart stuff, EKGs, echocardiograms, things like that, things that might give us a clue. And particularly on physical exam, if we hear a heart murmur or see swelling, things that would make us think there's a cause of your fatigue. But remember, 8 out of 10 times, we're going to strike out. We're not going to find anything. So moving forward, what do we do next? So what is the list of things that can cause fatigue? That 20%, that small group, not the 80%, the psychogenic or the lifestyle fatigue, but that small group, the 20%, the stuff that you don't want to miss. Everything from infection, like Lyme disease, we mentioned that. There are plenty of infections. I don't want to give you all the diagnoses, but metabolic disorders like diabetes or thyroid, hematologic disorders like anemia or blood production or even cancer, renal disease, liver disease, Rheumatologic diseases, I mentioned all that earlier. Stomach diseases, IBS, celiac, those things can really make you leak nutrients and you just don't ever get the energy back. Neurologic disorders like Parkinson's, dementia, multiple sclerosis, stroke. Sleep apnea is huge. Sleep apnea is huge. That's why I always tell men, if you got to fix 3 things, you got to fix your testosterone, your vitamin D, and your sleep apnea, or you'll never not feel tired. You will always be tired. Heart, congestive heart failure, coronary artery disease, blocked arteries. One of the classic symptoms of blocked arteries is I'm just tired. I can't do what I used to could do. COPD, and as I mentioned in my previous videos, vitamin deficiencies, particularly those B12 and phosphorus and vitamin D. All those things can make you very tired. So what about the 80%, all the 8 out of 10 people? The people that are just tired and there ain't nothing wrong with them. What do you think is going on? Obviously, here's a good question. When you go to sleep and you wake up, do you feel better? If the answer is yes, then you've got a sleep problem and we need to fix that. That's a good sign. If you go to bed tired and wake up tired, that's a bad sign as far as it being something we can fix. If you go to bed tired and wake up tired and you're tired all the time, then there's something going on with your sleep hygiene. You're not getting good quality sleep. Got a video on that. Go watch my sleep video and you'll understand what I mean by good quality sleep. You have to have it. Your body must have good quality sleep or you're doomed. Surgery. Did you know if you have surgery, it can, even just a little bitty surgery, anything, it can take 12 weeks, 3 or 4 months to not be tired from that. It's such a stressful experience. And a big surgery can take a year. I mean, you could just be tired because you had surgery. It's a big deal. Mood disorder. If you're depressed or anxious or have bipolar disease, you're going to be tired all the time. You have the potential for that to make you always tired. And there's nothing else wrong with you. Just the concept that you've got angst and you just don't feel well and you can't ever get past that. And that's important. See a psychologist. See your doctor. Get put on the right treatment. Let's take care of it. But we can make you less tired if we solve the underlying problem. So what about lifestyle? I can't count the number of people that were on heart medicine, blood pressure medicine, anxiety medicine. They quit their job or got a new job and whew, they didn't need anything else. So work dissatisfaction can be a big, big part of feeling tired all the time. Also, being sedentary, being lazy, being still makes your body adapt to that as its new normal. So when you just can't do things, the only way to make your body adjust to being alive is to move it. You got to move your body. So go back how to sleep better. One of the most important things is movement. You got to move your body. Deconditioning is a big deal. Poor nutrition, not resting, overtraining. Some people overtrain to the point of exhaustion. I've had a few people maybe even fire me as a doctor because I told them they were training too much. You got to train less. And they just didn't understand that. They were like, I don't want my doctor telling me to train less. That doesn't make any sense. Yes, overtraining is as bad as undertraining. You got to find that sweet spot where you're really taking very good care of your body. Eating disorders like anorexia or bulimia, substance abuse, obviously if you're abusing alcohol or drugs, or even prescription drugs can make you tired. And that brings me to the most important thing in the clinic. If you look up all these medications that we give you over and over and over again, what is one of the most common side effects? Fatigue. So we need to look closely at your medicines, particularly anything that was recently started when the fatigue started. So let me pause for a minute. Pause. This is important. Red flag signs. Symptoms that should ring a bell. Symptoms where you should just not assume that you're tired for no reason. Where you should come into the doctor and you should be seen. First, fatigue that is relieved by sleep or rest, refreshed in the morning. That can be any number of things, but it's definitely something wrong with your body. When you start asking it to do something and your body runs out of energy, that's a problem. And certainly heart is high on that list. That's something we're looking for. Another would be that you can do less than you could do 6 months ago and you get more tired. So let's say you're a golfer. This is classic. Golfers are the easiest heart patients to diagnose because they'll come in and say, I was walking 18 holes, I felt fine. Now I can only walk 10 holes. Trust me, I'd be walking them if I could, but they can't. That progressive fatigue with exertion, and that leads to something called dyspnea. Dyspnea is a medical term for a perception that you're not breathing well. But if you check somebody's oxygen, their oxygen looks good, but they just get winded when they try to do something. And it's new and it's a progressive. That kind of fatigue combined with dyspnea is a heart condition, probably until proven otherwise. Unexpected weight loss combined with fatigue, Obviously, it makes your eyebrows go up. No one should be losing weight unexpectedly, right? That wouldn't be normal. You could have high thyroid. You could have all kinds of problems, cancer for that matter, that makes you lose weight and be tired at the same time. You could also come in here tired and you don't look good. I mean, I take one look at you. I've been a doctor a long time. I take one look at you and I can just tell something's wrong with you. Ill appearing. What are the signs, the red flag signs? Something that would get my attention and make the hair on the back of my neck stand up. Lymph nodes combined with fatigue, goiter, swelling, heart murmur, liver pain, a big swollen tummy, joints that are swollen or red, things like that would make me think, oh, there's something going on here. And I'm not hoping for something like that, but it's nice sometimes when you can pinpoint what's wrong with somebody and not just tell them, hey, this is your fault. Although, wouldn't you much rather have something that you can fix by changing your lifestyle than have to have surgery or chemotherapy or radiation to try to fix? Trust me, you would much rather it be lifestyle. And remember, 8 out of 10 times, that's what I'm going to tell you. Hey, nothing wrong with you. You got to get off your butt. You have to change your lifestyle. All right, so how do we manage it? What are we going to do to manage it? So how are we going to manage your fatigue? If it's not, obviously, number one, if you're in that lucky group, lucky group of people that have a problem, we fix it. Boom, fatigue gone, right? Hopefully, but if you still have a horrible lifestyle, fatigue can be multifactorial. You could have something wrong with you and have a horrible lifestyle, right? You're probably not one of these people that has something wrong with you and you have a great lifestyle. Those are pretty far and few between. All right, you've seen my videos. You have to sleep right. You have to eat right, and you have to move right, all right? That's how you're gonna fix your fatigue. So what does moving look like? You need 150 minutes a week of movement. Call it what you want, exercise, movement, anything of moving your body 150 minutes a week. So divide that by 7, it's 20-something minutes a day. Well, let's say you do an hour one day. Okay, now you need 90 more minutes a week. I don't care how you get the 150 minutes, but 20 to 30 minutes a day would be perfect. I don't know anyone who exercises 7 days a week except maybe Buddy. Buddy might, but no one else does. I think that you want to get, or maybe even Bree and Buddy, the only 2 people I know probably exercise every day because they have to. But everyone else doesn't, but I don't care. I want 150 minutes a week of movement. Sleep. I got a whole video on sleep. You have to have high quality sleep in a dark, cold, quiet, comfortable environment. Fix your sleep environment. Stress reduction. Some people feel trapped in their stress. That's what psychologists are for, okay? Get yourself a good psychologist. They can make a remarkable change in your mood. And your mood gets fixed and your stress goes down and you feel a whole lot better. So that's the secret to fixing stress. Eat better. You already know what I mean by that, right? No sugar, no flour. You want to focus on, in my opinion, high quality foods, calorie dense, high in protein, and high in fat. Those are the things that are going to make you feel good. Fat gives you energy. Meat or high density calorie foods give you nutrients. So you're well fed, you're full and energized, not fat and hungry. Sleep well, good quality sleep, and move that body. Move. And 80% of the time you can fix your fatigue. All right, so everything you needed to know about fatigue in a nutshell. I have so many people who come in here, they know they're out of shape, they know they don't feel good. They just want me to make sure it's not one of those other things. I do that all day long, and I hope to inspire them and you to change it. You should not be tired. That beautiful specimen of a body that you've been given should not be tired. It should be running on all cylinders. You just have to take care of it. Imagine you were your own racehorse and it wasn't running very good. Boy, you'd be all over that. You'd have a lot of time and money invested in that racehorse. You would make sure it was fed right. You would make sure that it was probably massaged. You would make sure that it had the right saddle and the right blankets and the right temperature. You would really worry about that racehorse. It's okay to take yourself seriously like that and pretend that you're your own racehorse. Make sure that you are well cared for. Get out of your own way. Fix yourself, fix your food, fix your sleep, fix your lifestyle, get some movement, take care of yourself. It's so easy, and you would never ever imagine how good you can feel. So if you like this video, give me one of these. Please subscribe down there below. Help this channel grow even faster. Dr. Davis, East Texas. Have a great day. Thank you. Bye.